গত ক্লাসে বাংলাদেশের দূর দূরান্ত থেকে সকল মেডিকেল কলেজে আমার প্রাণপ্রিয় শিক্ষার্থীরা অনেক উৎফুল্লভাবে অনেক উৎসাহ ভরে আমার ক্লাসে অংশগ্রহণ করাতে আমি নিজেকে ধন্য মনে করছি। বিশেষ করে আমার এক্স স্টুডেন্ট কুমুদিনী উইমেন্স মেডিকেল কলেজ, নোয়াখালী মেডিকেল কলেজ, আব্দুল মালিক উকিল মেডিকেল কলেজ অ্যান্ড প্রেজেন্ট স্টুডেন্ট কক্সবাজার মেডিকেল কলেজ স্টুডেন্টদের অংশগ্রহণ আমাকে অনেক অনুপ্রাণিত করেছে। গত ক্লাসে আমরা অ্যানাটমিক্যাল স্ট্রাকচার অফ আইবল নিয়ে আলোচনা করেছিলাম। তো প্রথমেই আমি গত ক্লাসে ইম্পর্ট্যান্ট কয়েকটি কোশ্চেন নিয়ে একটু আলোচনা করি। যেমন গত ক্লাসের ইম্পর্ট্যান্ট টপিক ছিল লেয়ার্স অফ কর্নিয়া। There are 5 layers of cornea from outwards to inwards: epithelial layer, Bowman's membrane, stromal layer, Decime's membrane, and endothelium. Another important question was layers of retina. 10 layers of retina. Very, very important in 5th year student draw and label the 10 layers of the retina. Another important question is draw and label the different layers of cornea. Now we will discuss in today's class about system, tear film and orbit. At the very beginning, I wish to start lacrimal drainage system. Lacrimal drainage system, it is nothing but formation of tear and fate of tear from where tear film is formed and where it ends. That is the lacrimal drainage system. Lacrimal drainage system consists of 2 parts. One is secretory part from which tear film is formed. Another one is the excretory part, that means lacrimal apparatus. Here, this is lacrimal apparatus. This is lacrimal apparatus. It is consist of a small opening, both upper lid and lower lid. That is called the punctum. That is ampulla, horizontal, vertical. That is another part of canaliculus. It is upper canaliculus. It is lower canaliculus. It is called the common canaliculus. That is common canaliculus. Common canaliculus offends in the lacrimal sac. Lacrimal sac offends in the nasolacrimal duct. That is nasolacrimal duct. It is the drainage system of tear film, and from where tear is formed. Maximum aqueous layer of the tear film is formed by the main lacrimal gland, and also the 2 accessory lacrimal gland such as gland of Wolfering, and another one is the gland of Krauss. So we know that we already described that tear is from some exocrine gland. That tear goes through the tear meniscus, marginal tear meniscus, and the capillary action tear goes through at first both canaliculus, upper and lower canaliculus, then common canaliculus, then then lacrimal sac, nasolacrimal duct. This nasolacrimal duct is often in the middle meatus, inferior meatus of the nose. Very, very interesting part in our ophthalmology department, though it is the part of the ENT department, but in our department, very, very important is the lateral wall of the nose. This picture, this is the picture of bones in the lateral wall of the nose. We see the from forwards to backwards, nose is in the lateral wall of the nose. This is frontal process of maxilla, that is lacrimal bone, that is ethmoid bone. These three bones is very, very important. Lateral wall of the nose is very, very important in our ophthalmology department. And very interesting, in the lateral wall of the nose there is a two concha. It is the upper concha and this is the lower concha. Above the upper concha, upper meatus, in between upper concha and the lower concha, middle meatus, below lower concha, inferior meatus. This meatus is nothing. It is the space in the lateral wall of the nose. It is very, very important in our ophthalmology department because this lacrimal sac, it lies at the level of middle meatus, and opening of the nasolacrimal duct, it is often in the inferior meatus. So lateral wall of the nose is very, very important in our ophthalmology department. Now, diseases of lacrimal drainage system. Very, very important in 5th year students. It is the chronic dacryocystitis, very shortly called CDC, chronic dacryocystitis. This disease is very, very important in written examination, in viva examination, and it is the only case. It is present in every 5th year student, 5th year MBBS examination. That is the common disease, chronic dacryocystitis. This case is commonly present in the case. So this disease is very, very important. Another one is the acute dacryocystitis. Another less important diseases are obstructions in the maybe in the punctum, punctal stenosis, punctal atresia, punctal agenosis. Obstruction in the lacrimal sac may be possible. Obstruction may be in the opening of the common canaliculus, and more commonly occurs obstruction in the opening of the nasolacrimal duct, which opens in the inferior meatus. Now, what is chronic dacryocystitis? What do you mean by the chronic dacryocystitis? In the word dacryocystitis, lastly itis, some alphabets itis. So, any itis in any word, that means the inflammation. It is the chronic inflammation of dacryocyst. In ophthalmic name, dacryocyst, lacrimal sac. Its another name is dacryocyst. So inflammation in the lacrimal sac, it is called the dacryocystitis. Chronic inflammation, so chronic dacryocystitis. So dacryocystitis means chronic inflammation of lacrimal sac due to nasolacrimal duct obstruction. That is the definition of chronic dacryocystitis. What do you mean by the acute dacryocystitis? Acute dacryocystitis means acute inflammation of lacrimal sac due to nasolacrimal duct obstruction. That is called the acute dacryocystitis. Another very, very important disease is in our this topics in our this chapter is the congenital nasolacrimal duct obstruction. Congenital nasolacrimal duct obstruction. This disease is very, very interesting because in every pupil suffer, their babies or their family babies, brother's child or sister's child are suffering, watering, continuous watering from the birth, or from birth to the neonate, from birth to the infant stage. That is called the that problem is called the congenital nasolacrimal duct obstruction. Here, epiphora is occurs. Now, what do you mean by the epiphora? What do you mean by the lacrimation? This question is very, very important in the 5th year written examination and also the Viva examination. What do you mean by the epiphora and what do you mean by the lacrimation? Epiphora means excessive watering of the eye, due to obstruction, nasolacrimal duct obstruction, or obstruction in the common canaliculus, or obstruction in the anywhere in the lacrimal apparatus. That is called the epiphora. Epiphora means hampered drainage of tear film. That is epiphora. Production is normal, but its drainage is not possible. That is excessive watering. It is epiphora. What is lacrimation? Lacrimation is drainage pathway is okay, patent. Drainage pathway, lacrimal apparatus is okay, but excessive production of lacrimal gland, main lacrimal gland, excessive production of main lacrimal gland. That is the lacrimation. That is called lacrimation. Okay. This is the difference of lacrimation and epiphora. Now we will discuss about our important disease, chronic dacryocystitis. That means CDC. It is important. So its definition already described. Now what are the history you will take this patient, your case patient, chronic dacryocystitis? What you will take the history? Very important are color of the watering. It is clear or turbid. If any blood stain, it is intermittent or continuous. It is uniocular or binocular. These are always noted in case of history. Then we examine the patient. In the general examination, this patient blood pressure must be noted. That pressure's false anemia also be noted. But it is very, very important is blood pressure because during its surgical management, excessive hemorrhage occurs in the DCR surgery. Excessive hemorrhage occurs. So blood pressure should be noted to detect patient is hypertensive or normotensive. If patient is hypertensive, it must be converted into normotensive by using antihypertensive drug. It is not only DCR surgery, but in any surgery in our body, any hypertensive patient should be normotensive stage before his or her surgery. So it is important. Then nasal examination is very, very important. Nasal examination, we mostly exclude of the before DCR surgery must be exclude atrophic rhinitis, hypertrophy inferior turbinate, gross septal deviation, nasal polyp, rhinosporidiasis. These diseases must be noted before DCR surgery. So this examination is very, very important. Another ocular examination. Ocular examination must be done the patient by setting in the slit lamp. We must exclude any lid diseases, corneal diseases. We carefully examine the lid, cornea, punctum before DCR surgery, before its treatment. Now investigation. At first, laboratory investigation. Laboratory investigation 3. Bleeding time, clotting time. That means BTCT. X-ray paranasal air sinus. X-ray PNS, OM view, occipital view, then CBC, complete blood count, blood sugar count. These are the laboratory investigation. Some ocular investigation may be done, such as probing, irrigation, SPT, sac patency test, very important, sac patency test, fluorescence disappearance test, contrast dacryocystography. These ocular investigation may be done for diagnosis of chronic dacryocystitis. What is the surest examination for CDC is the SPT, sac patency test. Very important investigation. It is invariably, this question may be answered by our fifth year students, that how SPT is done. It is very simple examination procedure or investigation procedure, where there is a syringe. At first 5 cc syringe is taken, and 5 cc of normal saline is taken, and its needle is withdrawn, then fitted a lacrimal cannula. A lacrimal cannula is fitted in the syringe. Then patient is lying down is sleeping in the lying down. Then at the very beginning, we detect the punctum. That is the punctum. This punctum is at first natal sheath punctum dilator. That is, natal sheath punctum dilator is used to dilatation of the opening. Then this syringe is taken with filled of normal saline. Its nozzle, its tip of the lacrimal cannula is introduced through the punctum. Then pushing or syringing of the normal saline, and this normal saline goes through the upper canalicula's, then the common canalicula's, lacrimal sac, nasolacrimal duct, and this water goes towards the inferior meatus of lateral wall of the nose. If normal saline goes to the inner nose, then your interpretation is patent. If normal saline not goes in the nose and it withdraw through the punctum, that is your interpretation is not patent. So patent or not patent is the interpretation of SPT. Very important. Very important ocular examination procedure. Now treatment is surgical. Name of surgery is either DCR or DCT. Now indication of what is DCR? DCR is definition of DCR or procedure of DCR is very important in viva examination of fifth year student. What do you mean by the DCR? DCR is a bypass surgical procedure where cutting intervening bone and communication is done in between lacrimal sac with nasal mucosa at the level of middle meatus. This is the simple diagram for DCR surgery. Simple diagram for DCR surgery. That is the lacrimal sac. That is the bones in the lateral wall of the nose. That is inner side of the mucosa, nasal mucosa. At first, in the theme or gross of DCR surgery is that at first we cut the lateral wall of the nose, bones in the lateral wall of the nose, and form a osteotomy, and that is the relief of bones at the level of the middle meatus. Nasal bones are lateral wall of the nasal bones are removed. And very important, very important question. Name the instrument. Name the instrument which is used for cutting of the bone. Now the name of the bones is called the DCR bone punch. Another one is the trephine with central fixator or without central fixator. These two instruments, one is DCR bone punch, another one is trephine. Trephine with central fixator or without central fixator is used for cutting the nasal bone in the lateral wall of the nose at the level of the middle meatus. So we relieved, we form osteotomy, and we cutting the here and remove this piece, and we cutting the here remove this piece, and that is the upper flap of lacrimal sac. It is the upper flap of nasal mucosa. It is the lower flap of nasal mucosa. That is the lower flap of lacrimal sac. Then this lower flap to lower flap and upper flap to upper flap is suturing and formation of a bypass root. That is the bypass root is formed in the DCR surgery. So when we form the bypass root, then lacrimal fluid, that means tear does not goes to the nasolacrimal duct. It goes directly at the level of the middle meatus from lacrimal sac to the nose. That is very interesting surgery in the DCR surgery. So now what is DCT? DCT is nothing. It is removal only removal of lacrimal sac. Only removal of the lacrimal sac is called the DCT, dacryocystectomy. Dacryocystectomy. DCT means dacryocystectomy. That means removal of lacrimal sac is called the DCT. Now, what are the very important question? What are the complications of DCR or DCT surgery? Perioperative complication. Two important perioperative complications are: number one, hemorrhage, excessive hemorrhage, which hampered the surgery of the surgery in the surgeon. And another one is the injury to the surrounding structures. Surrounding structures means injury to the angular vein, injury to the nasal mucosa, injury to the lacrimal sac. These structures injury is very grievous complication during DCR surgery. Now, what are the postoperative complications of DCR surgery? Postoperative complications are hemorrhage. Early complications are hemorrhage, infection, and late complications are scar in the incision mark, scar, and also the failed DCR. Very important question. Failed. What do you mean by the failed DCR? And what is the management of failed DCR? Failed DCR means after DCR surgery, again passage is blocked and again epiphora is formed. It is look like CDC of previous patient. So it is one of the so harmful complications of hazardous complications of CDC patient after surgery. This complication. Failed DCR. What is the management of failed DCR? Management of failed DCR. Management of failed DCR it is treated again surgery. Name of surgery is re-DCR. Again DCR. Re-DCR with intubation. Re-DCR with silicone tube intubation. Another procedures are DCR surgeries. Another procedures are endoscopic DCR, laser DCR, endoscopic DCR, laser DCR, endonasal DCR. These are the other types of DCR surgery. Now, very shortly, acute dacryocystitis. Acute dacryocystitis, it is more common in our, but it is less important in the examination. It is acute inflammation. There is a complication. Complaints of the patients are swelling in the lacrimal sac area. Lacrimal sac is located. Where is lacrimal sac? Location at the level of the medial canthus, in the lateral wall of the nose. Lacrimal sac is located in the fossa for lacrimal fossa. That is the lacrimal fossa, and here lacrimal sac is located. And another important detection of where the lacrimal gland is located. Lacrimal gland is located in the roof of the orbit. Where? In the lateral 1/4 and medial 3/4 junction. Here at the level lateral 1/4 and the medial 3/4 junction. Here there is a fossa for the lacrimal gland, and lacrimal gland, fossa for the lacrimal gland is located. And lacrimal gland also has two parts, orbital part, fallopian part. It is not in these topics. Now, congenital nasolacrimal duct obstruction. Congenital nasolacrimal duct obstruction. It is very common in our country, not only in our country, in the world war. Is a great problem of the baby. What is it? It is after delivery, after born, our lacrimal apparatus is canalization is completed. Inner lumen's canalization is completed, but very 96% babies are patent after delivery. But some of the baby after 1 year, 96, only 4% babies do not canalization occurs, and patent of Hasner's valve, resulting epiphora or watering of the baby, neonate baby, infant baby. It is a great problem. Its treatment is also very simple. Hydrostatic massage in the lacrimal, over the lacrimal sac area. Hydrostatic massage. It is done in the 6 hourly, and in each time its frequency is 10 times. So this massage, when you massage over the lacrimal sac area, there is the hydrostatic pressure push the Hasner's valve, and it is removed, and passage is again patent. So it is very simple procedure of hydrostatic massage, and associated with antibiotic eye drop, antibiotic ointment may be used in the baby. So it is very, very important in your personal life also. Now we will discuss another important topics is tear film. Another important topics are today's class is tear film. Why tear is very, very important in our eye? Because it is not only water, it contains glucose, nutrition, glucose, oxygen, infective agents such as immunoglobulin G, immunoglobulin A, lactoferrin. These important structures of the important constituents is always lies in the tear film. So tear film is the protector of our eyeball. It protects our eye. It gives nutrition to our cornea. That's why tear film is very, very important. Now, what are the constituents or anatomical structures of tear film? This figure. This is the film of tear film structure. It has 3 layers. Most outwards to inwards. Outer lipid layer, middle maximum 90% thickness, middle aqueous or watery layer, inner mucin layer. Now, very, very interesting is outer lipid layer. This secretion is formed by the Meibomian gland, and middle aqueous layer, or watery layer. This layer is formed by the lacrimal gland, and inner mucin layer, it is formed by the goblet cells in our conjunctiva. Now, what is tear film deficiency? Tear film deficiency disease is called the is called the dry eye syndrome. Now, what is dry eye syndrome? Dry eye syndrome means, it is a definition of dry eye syndrome. It is an ocular surface disorder where inadequate volume of tear film, or when tear film's stability is lost, that means unstable tear film, that is called the dry eye syndrome. Now, what are the causes of dry eye syndrome? Causes of dry eye syndromes are such as xerophthalmia due to vitamin A deficiency, number 1. Number 2, keratoconjunctivitis sicca. Number 2. Number 3 is the Sjogren syndrome. Number 3. Number 4 are due to mammalian gland dysfunction. Number 5 are exocrine gland disorders, Sjogren syndrome, exocrine gland azanosis. So this is the causes of dry eye syndrome. Now, what are the investigations are done? What are the investigations are done for dry eye disease, dry eye syndromes disease? Sharma test. Important is Sharma test. Another one is the tear breakup time. Another one is the fluorescence disappearance test, and also the marginal tear meniscus height. So, what are the ocular investigation or examination is done for diagnosis of dry eye syndrome? Number 1, Sharma test. Number 2, tear breakup time, tear meniscus height, and the dye disappearance test. Another name is the fluorescence disappearance test. Now, what are the treatment of dry eye syndrome? What are the treatments of dry eye syndrome? Dry eye syndrome diseased patient are treated at first education of the patient. Then the very important medication is the eye drop tear substitute. What are the tear substitutes are used for dry eye syndrome? These substitutes are carboxymethylcellulose, carbomar, dextran 70, hypromelose, carboxymethylcellulose, hydroxypropyl methylcellulose. These preparations are available in our country, and these tear substitute, artificial tear substitutes, are used in dry eye patient. This is the dry eye syndrome. Now we will discuss about the very another important topics we will discuss is the orbit. Very important topics, orbit. This is the anatomical structure of the orbit. We know that in our eyeball is located in the orbit. Orbit is a bony socket or bony cavity. It has 4 walls. Upper wall is called the roof. Lower wall is called the floor. Medial wall, lateral wall. Its constituents is the bone, no only bone. So it is frontal bone. It is maxilla, body of the maxilla. It is frontal bone. From the frontal bone, there is a process, orbital, there is a plate. There is a plate that is called the orbital plate of frontal bone. Roof of the orbit is formed, orbital plate of frontal bone, and most behind the laser wing of sphenoid bone. 2 bones. One is the orbital plate of frontal bone, another one is the laser wing of sphenoid bone. This is the orbital plate of frontal bone, then this is the laser wing of sphenoid bone. These 2 bone helps to form the roof of the orbit. Now, floor of the orbit. Floor of the orbit is formed by the 3 bones. It is the It is, what is it? Zygomatic bone. It is zygomatic bone. It is maxilla, zygomatic bone, maxilla, and the palatine bone. These three bones form the floor of the orbit. Now lateral wall. That is floor of the orbit. Floor of the orbit. That is zygomatic bone. Zygomatic bone. That is the this is the body of the maxilla, and also the palatine bone. These three bones form the floor of the orbit. Now lateral wall of the orbit. Lateral wall of the orbit is formed by the, that is the zygomatic bone. That is zygomatic bone, and also the greater wing of the sphenoid bone. That is zygomatic bone. That is the greater wing of the sphenoid bone. These two bones form the lateral wall of the orbit. Lateral wall of the orbit is most hardest wall, most hard wall in our orbit. Then medial wall. Medial wall is formed by the three bones. That is the maxilla, and from the maxilla towards the frontal bone, there is a process. It is called the frontal process of maxilla. Behind the frontal process, lacrimal bone, then ethmoid bone. That is frontal process of maxilla. Where this is frontal process of maxilla. That is maxilla. It is lateral medial wall, frontal process of maxilla. Then that is lacrimal bone. That is the ethmoid bone. These three bones form the lateral wall of the medial wall of the orbit. Medial wall of the orbit. So it is the anatomical structure of the orbit. Now, what are the contents of the orbit? Orbits contains maximum bulk by the eyeball and extraocular muscles, superior rectus, inferior rectus, lateral rectus, medial rectus, superior oblique, inferior oblique. These 6 extraocular muscles, and also the nerves such as frontal nerve, lacrimal nerve, trochlear nerve, lacrimal nerve, and the abducent nerve, and also the vessels such as lacrimal vessels, ophthalmic vessels. These are the contents of the orbit. Now, very important structure, superior orbital fissure. What are the structure passing through the superior orbital fissure? Very important in the written examination. This figure drawn my sister. This is what are the structure passing through the superior orbital fissure? Frontal bone, lacrimal bone, trochlear nerve. Frontal nerve, lacrimal nerve, trochlear nerve, and the superior ophthalmic vein. Then it is the abducent nerve, upper division of the oculomotor nerve, lower division of the oculomotor nerve, nasociliary nerve, and more inferior inferior ophthalmic vein. These is important structures which are passing through the superior orbital fissure. And what are the structure passing through the optic canal? Very easy. Optic nerve and the ophthalmic vessels, ophthalmic artery and the ophthalmic vein. That is the what are the structure passing through the superior orbital fissure and the optic canal. This is optic canal. This is superior orbital fissure. This is inferior orbital fissure. Superior orbital fissure, inferior orbital fissure, optic canal. Now, very important are proptosis and the exophthalmos in the orbit. What do you mean by the proptosis? What do you mean by the exophthalmos? At first, exophthalmos, forward bulging of both eye due to thyrotoxicosis is called the exophthalmos. Exophthalmos is, this definition is only cause of thyrotoxicosis. But in case of proptosis, it may be uniocular, may be binocular, and causes of proptosis is the vast. Proptosis means uniocular or binocular forward bulging of the eyeball due to any cause, that is called the proptosis. That is the basic difference of exophthalmos and the proptosis. Now, some small important definitions are: what do you mean by the ophthalmoplegia? What do you mean by the ophthalmoplegia? Defective motility of the eyeball, elevation, depression, adduction, abduction. These movements are very slow or inadequate movement of the eyeball. That is called the ophthalmoplegia due to any cause. What do you mean by the dystopia? What do you mean by the dystopia? When eyeball is dislocated from its corneal plane due to any cause, that is called the dystopia. Dystopia means dislocation of the eyeball from its corneal plane. That is called the dystopia. What do you mean by the pseudoproptosis? Very, very important. What do you mean by the pseudoproptosis? Very interesting. Pseudoproptosis means look like proptosis, but there is no bulging of the eyeball. That means normal eyeball is normal in location, no forward bulging, but look like the proptosis is called the pseudoproptosis. Now, what are the causes of proptosis? Very, very important. What are the causes of proptosis? Proptosis is forward bulging of the eyeball. So, any extra accumulation in the orbit push the eyeball, resulting proptosis. It is its cause is very, very, very simple. Orbits constituents or space is limited, fixed. If extra mass, if extra constituents come in the orbit, resulting pushing of the eyeball forwardly, resulting proptosis. Now, what are the causes? At the very beginning, tumors, lacrimal gland, adenoma, orbital lacrimal gland carcinoma, then tumors of the lacrimal gland, then optic nerve glioma, optic nerve covering, optic nerve sheath meningioma, lymph node in the orbit, lymphoma, and vascular malformations, vascular tumors, such as cavernous hemangioma, and capillary hemangioma. These vascular tumors, also the culprit for proptosis, called proptosis. Thyrotoxicosis, thyroid eye disease. Thyrotoxicosis is the another cause of the proptosis. Infective diseases, infections such as preseptal cellulitis, orbital cellulitis, orbital pseudotumor, mucormycosis. So these are the infective cause for proptosis. Now, we will discuss about these are the tumors, optic nerve, and these are the causes of the proptosis. Now, we will discuss the thyrotoxicosis or thyroid eye disease. At the MBBS level, during my MBBS period, I knew that thyrotoxicosis is the only cause of proptosis. But when my MS course, I knew that not only thyrotoxicosis, not only hyperthyroidism, hypothyroidism and hyperthyroidism, both are culprit for exophthalmos. So now it is called thyroid eye disease. Now, what are the manifestations of thyroid eye disease? Number 1, soft tissue involvement. Number 2, proptosis. Number 3, optic nerve, optic neuropathy. Number 4 is lid retraction. Another one is the restrictive myopathy. In the written examination, one of the important question is why proptosis or exophthalmos occurs in the thyroid eye disease. Why? Very interesting is in thyroid eye disease, either thyrotoxicosis or hypothyroidism, there is a inflammation of orbital structures occurs, extraocular muscles, also fat, fascia, connective tissue. Their inflammation occurs, and inflammatory cells such as neutrophil, plasma cell, and lymphocytes all are aggregated inside the extraocular muscles, orbital fat, and glucose aminoglycans is accumulated inside the extraocular muscles, and imbibition of water towards the extraocular muscles. The extraocular muscles are hypertrophied. You all know, you are all of our students know what do you mean by the hypertrophy, what do you mean by the hyperplasia. Hypertrophy means increase size of the cell, resulting increased size of the cell due to any cause and resulting increased size of the organ. That is called the hypertrophy. And hyperplasia means increased size of the organ due to increased number of the cell inside the organ. That is the hyperplasia. Here hypertrophy occurs. Imbibition of water occurs towards the extraocular muscles, inside the fat, connective tissue, and also the optic nerve, resulting more engorgement, and they occupy maximum bulk of the orbit, resulting pushing of the eyeball forwardly. That is the mechanisms of proptosis or mechanism of exophthalmos due to thyroid eye disease. Now, other manifestations of exophthalmos is the causes of exophthalmos manifestations are the lid retraction. Very important. Lid retraction is one of the causes of pseudoproptosis. Very interesting. If lid retraction of in my left eye, my left eye look like the proptosis, but my left eye is not really bulged in the forward, but look like the proptosis. So lid retraction is the one of the cause of the pseudoproptosis. Now some examples of pseudoproptosis, such as same eye, that means ipsilateral eye pseudoproptosed. When pseudoproptosed in the ipsilateral eye, one is a lid retraction, another one is the ophthalmos, megalocornea, that is the look like the proptosis, but eyeball is not bulged in the forward, so it is not proptosis, look like proptosis. It is called the ipsilateral proptosis, pseudoproptosis. Contralateral proptosis means my eye is normal, but this eye is very small. There is a ptosis. This eye is ptosized, but this eye is normal, but this eye look like the proptosis. That is called the contralateral cause of pseudoproptosis. Here the end of the today's class. We will discuss vastly very important topics in our fifth year, my heartiest fifth year students, such as lacrimal drainage system, tear film, orbit, DCR, procedure of DCR surgery. What are the very important is what are the bones cutting during DCR surgery? Very important. Here, which bones I cut by the trephine or DCR bone punch? Two important bones. One is the maxilla, that means frontal process of maxilla. Another one is the lacrimal bone. Two bones are cutting during DCR surgery. This is very important. And another important topics is what are the indication of DCR surgery? What are the indications? Chronic dactylic cystitis. Another one is the lacrimal farm failure. Two indication of chronic dactylic DCR surgery. One is chronic dactylic cystitis CDC. Another one is the lacrimal farm failure. What are the contraindication of DCR? Very important in the Viva question. What are the contraindication of the DCR? Contraindication of DCR is number one, nasal diseases such as atrophic rhinitis, gross septal deviation, rhinosporidiasis, and also the lacrimal sac tumor malignancy, and also DCR is contraindicated in the more elderly aged patient, such as above the age 70, above the age 50, 80 years. Here DCR is not done, DCT is usually done. Now, what are the indication of DCT? Those are contraindicated of DCR, that is the indication of DCT. Very simple. Indication of DCT is the atrophic rhinitis, elderly aged patient CDC, and the atrophic rhinitis, rhinosporidiasis, and lacrimal sac growth. That is the indication of DCT. Thanks to before stoppage of completed of our class. Now we again review most important questions of our class in the for fifth year students. Very important are tear film, layers of the tear film, and lipid layer, aqueous layer, mucin layer, layers of the tear film, and the functions of the tear. Functions of the tears are outer lipid layer. Outer lipid layer, it prevents evaporation of aqueous or water. It prevents evaporation of aqueous and maintains the tear film stability. And middle aqueous layer, it contains water and oxygen dissolved, and also some soluble substance, sodium, potassium, calcium ion, amino acid, pre-fatty acid, and also the glucose, urea, also the constituents of are all soluble in the water layer, aqueous layer, and it gives the corneal nutrition. Oxygen goes from this layer. And mucin layer, very important anti-infective agents such as gamma globulin and the lactoferrin, interleukin, cytokines. It contains this layer, and it helps the anti-infective agents, and it protects of our eyeball from the environmental organisms. So very important this layer. This is very important. Another review is it is important lacrimal draw and level the lacrimal apparatus, and also the CDC of the CDC patient, lacrimal sac disease, only lacrimal sac infection, chronic dactylic cystitis, lacrimal sac, chronic inflammation, it is the chronic dactylic cystitis. And very important DCR surgery. Principles of DCR surgery is very important, and what are the bones cutting during DCR surgery, very important. What are the complications of DCR, perioperative complication and the postoperative complication. Failed DCR, management of failed DCR is very important. Draw and label the orbit and contents of the orbit, very important question. Very important question is the draw and label. There are two instruments. It is the Calazion clamp. It is the lacrimal cannula, and lacrimal cannula is fitted in the syringe, and it is the punctum dilator which helps to the dilatation of the punctum. And see, after syringe, after introduce of the normal saline in the cannula, in the syringe, and cannula is fitted, then water is pushing through this pathway, and patency is examination. If patency is tested, that is the DC, but that is the SPT, sac patency test is very very important. Sac patency important, DCR procedure important, orbit anatomical structure and contents of the orbit important, and lacrimal apparatus important, tear film important. And this is another written examinations questions is the what are the structures passes through the superior orbital fissure. And so today's class is very very important class for our 5th year MBBS student. Thanks to every students for patient hearing. I am so grateful to you for attentively attending in my class. Everybody thanks. Allah Hafiz. Assalamu alaikum.